My name is Evan Rakaseka, and today I'm speaking with Sarah Abbas. We are conducting this interview as part of the IUP Oral History Program's Coronavirus Collection. We are conducting our interview over Zoom, and Sarah, thank you for joining me today. Can you spell your first and last name for me, please?
Sarah, Sarah, Abbas, Abbas.
Thank you. Okay. When did you first hear about COVID-19?
I first heard about COVID-19 probably in early January, where I was doing my internship. Um, one of the employees there's cat got coronavirus, and then we looked it up.
That's a little different. And you said that this was at your internship, correct?
Correct.
Uh, and um, what did you think when you first heard about the virus?
Um, I didn't really think much of it. Um, I just knew it was um, COVID-19. The strand was based in Wuhan, um, but there's other like strands of COVID. And
Yeah. Did you think that it was going to get um, to the point where it is currently?
no,
Okay. And where were you when the lockdown began? Like, where were you living?
I was living in Lancaster, Pennsylvania.
Okay. Uh, okay. And what were you expecting things to be like during lockdown? Like, were you expecting it to be kind of just a quick thing, or were you expecting it to end up being something like more along the lines of like a long-term type of thing?
Um, Initially, I thought it was going to be relatively short because what they wanted to do was flatten the curve, and they said that would like take only a few weeks. But as time went on and like PPE was continually not available for like hospitals and stuff, I expected it to be longer after the initial few weeks.
Yeah. Hmm. And then you said that you had an internship. What was that internship, and what was it like during the first few months of the lockdown? And like, how did the coronavirus affect your internship, as well as if you had a other like job while you were working at your internship?
Um, my internship was at a hospital, specifically Lancaster General Hospital, and I was a student intern studying nuclear medicine, and um, in March they completely like canceled my clinicals. I was canceled for about like 3 months, and my classes were all shifted online. And I from March to June I wasn't in clinicals. That's the internship, and um, yeah. And then I had a job at a retirement home prior and during the pandemic, and we were considered essential workers.
Yeah.
So I still went to work, and for the safety of our residents, we first removed in like dining in the dining room
Yeah.
and moved to a like takeout service where they would come down and get boxes filled with the food of their choice, and they could pick it and they could see it and take as much as little as they want. And then during the later phases of the virus, like in the early spring, we went to completely like contactless like delivery. No
Oh, wow.
residents came down to the dining halls, and we delivered their food to their doors. We'd knock and leave.
Hmm. And then are things still similar to that, or have they changed since then?
Um, for my internship, I went back in June, and we were required to wear a whole bunch of like PPE and
Yeah.
take like COVID specific modules on how to interact with COVID positive or patients under investigation cases
Yeah.
um, in a proper manner, and like how to don and doff PPE and such. Um, in the hospital, because of COVID, and in our outpatient centers, our numbers were drastically reduced. People weren't coming to the ER for the various reasons that they do, because the ER was considered a hot spot for coronavirus.
Understandably.
And then for my work, we've gone back to where the residents can come down and get their food like served in a takeout fashion where they can see the food and interact with others, have more contact, as well as we've opened a very small portion of our dining room for residents to eat. Um, these residents can only be down in the dining area for about 30 minutes,
Yeah.
and we have to give them hand sanitizer and such not, and they're not allowed to get up and move to other tables, talk to other unmasked residents, and the server has to wear a protective PPE, face shield, and mask, and they have to get everything for the residents that choose to dine in. But dining in isn't a very popular option. Um,
Yeah.
most just take their food back home.
Okay. Um, and do you think COVID's affected like what you've been studying and what your internship was for, like long term, or do you think it's going to end up being something that's going to be like a short term impact on it?
Um, can you repeat the question? I'm sorry.
Yeah. Um, do you think COVID-19 has affected your job? Well, job and what you had your internship for in a way that's going to impact them in a long-term way?
Um, not necessarily. For my internship, I did miss out on some routine like studies that we performed because of COVID. I had to mock a couple of procedures that were required to graduate. So I never properly exhibited the skills on some of the procedures, but
Yeah.
you often have to learn on the job. Uh, it definitely taught me a new way to handle patients with precaution, since every patient was a precaution. As for work, um, I don't really think it affected much. I mean, it affects the residents more so than myself.
Yeah.
It just makes my job a little bit more factory line, I
Yeah.
guess.
Okay. And you don't think that like at the retirement home that they're going to stick to something similar to this like long term, or do you think that they're going to end up switching back to how things were originally?
It's hard to say because they've allowed guests back in addition, like not into the dining room, but into the community.
Yeah.
Um, so if they went back to a more contactless system again, they would have to stop visitors and stuff. And I don't know if the residents would be very happy about it, but it'll all depend on which is looked at more, the mental health aspect or the
Yeah.
like pandemic precautionary health
Yeah.
precautions.
Okay. That makes a lot of sense. Um, do you feel that COVID-19 has affected your academic um, and career opportunities in any way?
Um, yeah, COVID, academically, I lost 3 months of experience. I did graduate from my internship, um, but I lost 3 months. I only went a few weeks extra from when the semester was supposed to end. So I did lose some experience in that regard, as well as hospitals aren't really uh, hiring for kind of ancillary medical personnel. It's kind of all focused on what's working in their ICUs and stuff.
Yeah.
So yeah, and then online, we missed out on a couple of planned things like workshops and such because our school banned any in-person
Yeah.
meetings and stuff. So yeah, I would say that it was impacted.
Yeah. I'd say a fair bit too, from what it sounds like. Um, and do you believe that the changes in like that COVID has brought have um, like overall and like how you're living your daily life, how work has been, and how like your schooling and like your internship um, has altered like your work ethic at all? And if it did, how do you think that it's changed it?
Excuse me, sorry.
It's okay.
Um, um, I don't particularly think it's changed my work ethic. My job isn't the same. Um, it is a lot easier. It is a lot more boring. Um, it's not as like attentive as I was like a waitress before. But like I still like want to make sure my residents are fed. I don't really know if it's made a difference. Uh, it's hard to compare because it's not really the same job anymore whatsoever.
Yeah.
Whereas school, I feel like has also been different due to the circumstances. A lot of my classes early in the pandemic didn't know how to like in which direction to move. So
Yeah.
they my professors would post like PowerPoints and no like supplementary material. It would just be the PowerPoints which they would normally give a verbal lecture to,
Yeah.
but that was lacking for a large portion of the pandemic. Um, as well as like the class like interactions or like questions like a professor would like be like, and where do we see this, and sometimes it would be like, I don't know, and you wouldn't be able to know the answer. Like it would be in the PowerPoint and be like, what does this compare to? So in
Mhm.
that regard it was like that,
Yeah.
which resulted in me referring to like printed materials more, like my textbooks and stuff,
Yeah.
more than I had previously. Whereas before I would record the lectures that they would give and I would re listen to those. But my method of learning had to be switched to my textbooks to fill in the gaps that the PowerPoints were missing.
Yeah. Hmm. And then do you think that it's been overall easier or harder um, working with the restrictions that COVID has brought compared to how things were before COVID?
What?
Do you think that things are easier or harder, like in general, whether, especially with like how like classes are, um, like, do you think that it's easier to do classwork online compared to in person? Um,
I prefer, it's it depends. For the most part, for a full schedule, I would prefer to have an in-person class because it gives you a schedule as a student, especially a full-time student if you don't really work. It gives you that sense of a schedule. Say
yeah,
you would have a class Monday, Wednesday, Friday, and you would have like a 2 hour gap between a class. Whereas before in person, I feel like most people would maybe do something with that time, whether it be homework or going to a professor's office hours or meeting with friends. You can't really do that online.
yeah,
Like, there's a loss of, uh, personally, there's a loss of like motivation to want to do the stuff because you're just looking at a web page. Like,
yeah,
so I would say it was harder. It's
yeah.
harder.
And then for your job at the retirement home, do you think that you as an individual prefer the way things are currently compared to how they were during like the main portion of the lockdown or how they were before COVID?
Um, I mean, my job's really easy now, but on the flip side, it's really boring and the hours are drastically cut. So I would say that before, I prefer before, even though it was harder and a lot more to do.
Yeah,
It was something to do, whereas now it's just kind of like scooping oatmeal onto a plate for 5 hours.
Cool. Um, that I can see how that would be a lot less interesting and less enjoyable than your normal pre-COVID job.
Yeah,
Um,
there's a severe like loss of interaction.
yeah. And then what helped you get through the quarantine and lockdown period? Did you pick up any new hobbies or interest, or did you just do a lot of like self-reflection, or was it something else entirely?
Um, well, I was considered an essential employee, so I didn't really get to just hang out at home. So what I did was I went to work, which well, the pandemic has been difficult and I wish it didn't happen. I was with my internship being a full-time hospital job. I was lacking funds, so it was nice to be able to go to work. Um,
Yeah.
but what I did was I went to work and I read my textbooks, um, and I stayed at home. Other than that, I only went to work.
Okay. Um, what things do you miss about life before COVID-19?
Um, I miss going and doing things. Um, I mean, as COVID is on the rise, over the summer, I felt a little bit more relaxed and went out to eat. I mean, that's about the extent of going out that I did,
Yeah.
but I miss going out in public and not feeling threatened and to a threat to others. I would love to just like, I don't know, just go and be around people and not be afraid of bringing something home, getting sick, making others sick.
Yeah. And then do you think that there's a possibility for things to go back to the way things were before COVID-19 anytime soon? Or do you think it's still going to be a long time, if at all?
Um, I don't know. Uh, I feel like it's not going to be forever, but I don't foresee it being within maybe the next year.
Yeah.
Um, hopefully by the next 5, hopefully a lot earlier. Because even with like a COVID vaccination, a lot of people can't get certain vaccinations, and then other people don't believe in vaccinations, and then other
Yeah.
people aren't going to get it because they're afraid, maybe.
Yeah.
And I think people are not going to want to quarantine again.
Yeah. It, I can definitely see where you are coming from with that line of thinking. And it, it's it's going to be interesting to see how things play out.
Yeah.
Um, okay. As somebody who's did the like an internship in a hospital, um, how did the pandemic give you a new perspective about how um, like public health and the health system? Does that question make sense?
Hmm? You like didn't finish your thought.
Oh, um, as since you did your internship in a hospital, um, did that give you, especially during a pandemic, did that give you any sort of new perspectives about how public health and the health system operate?
Uh, um, I mean, it's patient based. If you don't have any patients, you don't got any work. It gave me that sense, not particularly while I was actively being an intern, but when I was sent away from the hospital to quarantine for those like 3 months, um, I know that uh, what I work with, they're called technologists. The technologists were either sent home, they didn't
Yeah,
have really any work, and they couldn't really apply for benefits because they still were like actively on like the payroll. And then others who didn't want to see like a pay cut would work on the ICU floors, doing various tasks for the nurses, like cleaning the machinery, donning and doffing them so they didn't have to accidentally expose themselves by improperly removing their PPE, and several other tasks. A bunch of them became thermal screenings. So
yeah,
during the pandemic, kind of the workflow of the hospital changed, where people whose field maybe wasn't as high in demand kind of saw a change in what they did. I imagine that the people who schedule patients and stuff like that, they also saw a decrease in their work. And then, like, after things started kind of opening up, our patient load was small because most people were afraid of the emergency room because that would
yeah,
be a optimal place to contract the coronavirus. But on the other hand, medical emergencies still happened. What we do is a lot of cancer patients, and cancer isn't going to wait for a pandemic to be over.
yeah,
So we would have to bring these patients in who are immunocompromised, and we would have to like take even more like cleaning steps. Like we already cleaned with medical grade stuff, but we moved to maybe more harsh material such as bleach, which requires a longer like sitting time, but we have to keep our immunocompromised patients safe.
yeah. And then has COVID given any other like new perspectives, especially when like looking at like government and how like society views things as a whole?
Um, well, I guess it's shown how easily something like a virus can become political, when it's something that'll affect anybody, no matter who or what, whatever you believe in. Um,
Yeah,
and I don't know, people are gonna not wanna do what they're told sometimes, or and then people will go like overboard. Um, it's interesting to see like people who don't wear their masks, and then like the fear mentality where everyone goes and buys all the toilet paper,
yeah,
even though they already have like seven Costco packs at home. Um, so it's like weird to see like the fear and then the like I can't think of the word. Just like not fear. Complacency? I don't know.
Yeah. Yeah. I can definitely see and agree with how easily that gets politicized. Um, and then since you were an essential worker, um, and didn't necessarily have like a lot of time like off during the pandemic, obviously, um, but was it kind of nice having, even though you still had to go to work, not having to be quite as rushed with other things that you had to do day to day, um, like on days off and stuff like that.
Um, I guess. Uh, yeah, I mean, it was kind of weird going from I was looking at my calendar the other day, um, and I had a lot going on, or like I had a lot going on, and then I had a lot planned to go on, kind of in the height of COVID. So it's kind of weird to go from 100 to kind of like 25
Yeah,
because school wasn't as intense. I didn't have to show up to school, um, make time to drive out to school. I didn't have to go and do my clinicals, which is 8.5 hours almost every day. Um, I didn't, yeah, so it was a lot less to do, but also I did go to work and I worked that full time that my clinicals would have been.
yeah,
And then instead of going to class, I was just reading my textbook instead. So
yeah,
it was weird being home often because I was always gone. I was at work, I was at clinical, I was at school, I was visiting like my friends.
yeah,
I was always out, and it was like weird being home with my family, all of us home at the same time
yeah.
for months on end.
Was that something that, with where we are now with the pandemic, do you think that that change has been something that has been helpful in any way, like for you personally?
Being home with my family.
Just that, and just the not being out like all the time, stuff like that. Like, is it something that you view as something that's been nice, or has it been something that you wish that you could go back to how things were?
The only thing that's been nice about it is I like don't spend as much money as I used to, like
Yeah,
drastically,
yeah,
like a lot. But other than that, I'm kind of extroverted and I miss like being with people and like not being scared. Like I got invited to a Friendsgiving and it got canceled, but I was really leaning towards not going because of everything that's going
yeah,
on. The cases in Lancaster have really
yeah,
taken a jump upwards. So I miss going out and doing that. Like I even though I've been saving money, I wish I could go and like spend my money on like the stupid things that I would do, like go do things.
yeah. And then, especially with Lancaster being a hot zone, do you think that there are things that should be being done or enforced more but aren't?
Um, Masks. I mean, I can't say that. I mean, I haven't really been out of the house very often, but I can't say that I've seen a ton of like people in places without a mask without being spoken to. I think maybe there should be steps for more like sanitation in places,
Yeah,
like at a restaurant, like having hand sanitizer, like at our work, we like the server like squirts a thing of hand sanitizer into your hands. Um, but most of all, I think what's really been making the cases go up is people have gone back to work and people are meeting up with family and friends and not really staying home as much as they did a few months ago. If one person gets it in your house, then it's likely someone else will. And then if that person gets it and goes to work and they work in maybe like cubicles that's not very far from each other and they might spread it
yeah,
through that and they take it home to their family and it just keeps growing. So I guess as much as nobody wants to go back to quarantining, it should be possibly more enforced for at least a small period of time.
yeah. And so, with how things are now and how things were earlier in the pandemic, what do you see being as like the new normal?
Um, I don't know. I honestly feel like masks will go away really quick. Except for like the hypochondriacs and stuff.
Yeah,
But I foresee masks going away like really quickly, even though they really should become like a cultural norm. Like a lot of Asian countries, just like wearing a mask is normal. Wearing a mask is fashion. Um, Honestly, I don't really see much sticking. I just think people who are scared of sickness might linger, but I feel like not much is gonna stick. Everyone's just gonna have like a house full of masks
yeah,
because people already like don't want to wear the mask, so I don't think it's gonna stay. And like washing your hands should be like a normal thing, but apparently it's not.
yeah. And then, do you think that a vaccine is going to have a big impact on the virus, or do you think it's going to be something that will be helpful but isn't going to make like end it?
Um, well, it really depends on how many people can and will get the vaccine because most vaccines need X amount of people to get it to work,
Yeah,
and especially like protect the vulnerable who can't like get the vaccine, like the flu shot. Many people can't get because they're allergic to an egg compound in it.
yeah,
Depending on what this vaccine is made with, it's possible they can't get it. And then people who are immunocompromised can't get a vaccine because their immune system's too weak to handle the small amount. And then there's people who aren't gonna get it anyway, even if they're healthy. So I think it'll depend. And it'll also have to see like what the side effects are because rushing a vaccine, even if it's effective in stopping coronavirus, it might have adverse side effects that are almost as bad as coronavirus or something. So
Yeah.
it it's hard to tell. And also, if a vaccine becomes available, it'll also depend on how much the creator wants to charge for it. Like polio was removed because it was free. But if
Yeah.
the coronavirus vaccine is like $200 a pop, some people can't afford that. And that's also another group of people who aren't going to get it, making that like threshold lower and lower.
Yeah. Yeah. Do you think though that if there is a vaccine, do you think that there's also going to be then, like, with all the vaccines that are being tested, do you think that it's going to be whichever one happens first, like gets approved first, or do you think that there's a chance for multiple vaccines to all be going at once?
Um, I don't know. I feel like it's gonna be whatever the FDA approves first, because like new drugs have to undergo like clinical trials. Like it has to become like uh investigational new drug and all of that. So I feel like whatever the FDA approves first will be the one to go to. Um, Not to say that like subsequent like efforts in the vaccine will like cease, but I feel like probably the first round of vaccines will be the first ones to get the stamp of approval, even if there's a more effective, low side effect one that comes afterwards.
Yeah. Okay. Um, so the next question I want to ask here is, with what do you think the US is doing well when it comes to COVID, and what do you think they aren't doing so well, especially compared to other countries around the world?
Honestly, I don't really think there's anything the United States is doing well. Like, sorry. Um, I guess that we have like, I don't know, like compared to like other places in the world, we have like our own like houses that are like far enough distance and made with like decent materials, and we have like water and sewage and stuff. That's like literally like it. What we could be doing better is we could be wearing our masks, like everybody. Um, we should be enforcing just like staying at home, like even if like things like don't shut down to the extent that they were. Like I've seen several posts online of people who met for Thanksgiving but didn't quarantine before Thanksgiving as recommended if they were going to meet.
Yeah.
And it'll be like groups of like 20 people. Um, and that's like how like super spreader like events occur.
Yeah.
So pretty much the United States should really enforce masks. And if you want to hang out, I guess like you should wear your mask hanging out and staying 6 feet apart. Um, but yeah, and then like trying to implement work at home as much as possible, even though it's very undesirable. Um, it's
Yeah. And so you did touch on like how people should be obviously like trying to stay at home and wearing their mask, but do you think that there's anything else that people could have done early on to help limit the spread, but it just didn't happen?
Um, early on, there definitely should have been like steps to be taken. I know the Obama administration did have like a like book for if a pandemic would occur, but I know it wasn't used. And not saying it would be like perfect,
Yeah,
but um, I feel like it was played off, but I don't think anyone really expected it to be the extent that it was. But I feel like early on we should have implemented travel bans, um, both internationally and nationally, unless for like an emergency.
yeah,
Um, feel like quarantine should have potentially be done earlier with the borders like closed, and we should have worked quicker at developing testing available to all. I feel like that kind of entered the scene very late.
yeah,
Um, and a lot of people I know, including myself, came down with a pretty like nasty, like kind of respiratory sickness like early on,
yeah,
which could have been COVID, and we would have never like known until later, obviously, or if we got like
yeah.
an antibody test. Um, but yeah, and like um, how long it took to get like PPE into our hospitals. It's kind of like alarming that we didn't really have like enough even at the very, very beginning.
Yeah,
So I think mostly the borders and like enforcing a quarantine earlier would have helped a lot more.
yeah. Okay. And then my last question is there anything that you'd like to share with me that I've not asked you about today?
Um, I don't think so.
Okay, that's fair. Well, Sarah, thank you for your time and willingness to share your experiences with me.
Thank you for having me.
Of course.